Wednesday Wellness Minutes, and we want to take a time aside from what we normally do as far as educating to make sure that our mission here at Secoya is clear, because it's really about empowering you as patients and as consumers and as people who are trying to optimize their health and get you the most out of it. So our mission is basically to redefine the health paradigm. It is to help you understand that prevention is the cure and that a pill for symptom paradigm is a flawed paradigm, which we've seen over the last decades. And we want to understand that what we're doing is we're getting to the root cause of illness. And by taking a medication to manipulate your body and your biochemistry, while in some cases it might be necessary if you're dying or need to have your life saved or kept alive, those are really important times. So there is a time for medicine because we have the best medicine in the world. But in general, dealing with the challenges that most of us are dealing with on a daily basis, the most important thing is to prevent illness and, if we can, recover from that using the most natural means possible. Most petrochemical-based pharmaceutical drugs are synthesized in labs. For example, if you take an aspirin, for example, for either some people take a baby aspirin to prevent heart attacks and things like that. What you want to appreciate is that used to be white willow bark, mixed with a little devil's claw and some stinging nettle and a bunch of other stuff like that. It was never anything in isolation, and what our infinite pharmacopoeia has shown is that anything in isolation is not necessarily the greatest thing. So you want to understand that by enhancing the body's ability to heal itself and helping the body to achieve its optimal function by detoxing the liver or rebalancing the microbiome in the gut or taking stress off the kidneys and things like that, what's most important is you want to understand that it is critical to A, first prevent, B, use the most gentle means possible to regenerate the body, whether that be with herbal, homeopathic, nutritional, or PEMF. That's our next step. And if we somehow have dipped into the dis-ease or into the full-blown disease state, then we need something super powerful like a drug, a medical pharmaceutical drug. Those are necessary at certain times. When people are really sick and they have not been doing anything to prevent their health from declining, you may need those. So we never want to discount them because our medical providers are the greatest people on the planet for saving your life or keeping you alive. But their diagnostic system, the ICD-10 system and the other codes that we use to label you other than John and Susie and Bobby and things like that, are there to define you in terms of a set of symptoms, and then they can treat those symptoms. But if you walk into a medical doctor and say, doc, I'm really interested in improving my quality of life. I really want to feel better, have more energy, have greater intimacy with my spouse, whatever it might be, there are all these different things that don't work under there. You might get an ED drug, you might get a fertility drug, you might get this and that and the other thing. But the basic premise is that in allopathy, which is medical science, generally speaking, the idea is that the physician knows better than the human body, than the healer itself. So in our world, our mission is to enhance the healer from within, because you're the healer, and as a doctor, my job is to teach you how to heal yourself and enhance your body's ability to heal itself. If you've ever heard me speak before, doctor means teacher. The Latin root of doctor means teacher. So I am obsessed with teaching people what they need to know, what their symptoms are, where they're coming from, how to get rid of them, how to never get them again. So that's my solemn promise to everyone I work with who chooses to say, I want to get to the root cause. I want to know what it is from top to bottom. And some people say, I don't really need to know, I just want you to fix it. Well, I'm still going to educate you in the process because I fervently believe that teacher is my #1 role. And I don't take that lightly, because if you don't understand something consciously, you cannot apply it biophysically or biochemically, right? So when we work on the brain through Q&RT resets, we disassociate old traumas and wounds or maybe inherited stresses like that come in on your DNA, just like your hair color, eye color, height, and weight. The traumas you've had in your lifetime, the stressors you've had. We can take the stress away. We don't get rid of the memory, we take the stress out of it so your nervous system can flourish, okay? Or look into organ systems. Maybe it's a liver detox. Maybe you need some macronutrients in there to help your liver package the toxins to get them out better. And then let's just say maybe your liver's dumping stuff into your small intestine, so small intestine can't handle, so we need some type of binder to pick those garbage things up and get them out. But understand that our solemn mission, our obsession here at Secoya Health is to help you know what's going on and help you fix these things. Not just mask them, not put some black tape over a red alarm sign on your dashboard, but actually fix the problem, get down to the root cause, whether that's in the organ, if it's in the microbiome, if it's in the brain, maybe it's a structural issue, whatever it is. But just understand that if you want to address your issues from a root cause standpoint, it's not always easy, but it's a simple process. You need to fix one thing and allow the body to enhance to a new level, integrate that new information, integrate the brain reset and things like that, and then shift to the next level. So our job is really to get you from what most people that are in the sick care world, they feel like the nose on their plane is heading down, right? They're going to crash. We need to get them level, balanced, and then we need to get them optimized. Okay, so that's how we operate here as far as helping people. We get them balanced so they're stable, feeling good, they're pooping well, sleeping well. They know how to get rid of their stress, not just manage it. We know how to handle their neuroemotional stressors and things like that, guide them through how to manage these relationships, and then start optimizing things so they can do whatever sport they want or have whatever fun they want with their kids or do whatever activity they enjoy on the weekends and stuff like that. So at the core, right, Secoya, tree. We spell it a little differently, but Secoya is the name of the tree, the great redwood in the forest, typical out in California and things like that. It's the tree of life, okay? It's about growing to your greatest ability possible, getting to your heights. It has ability to heal itself because it has tannic acids that can prevent forest fires from consuming the tree as well. If you ever look at the contrast, Secoya is gigantic. It's hundreds of feet tall at times, depending on the biggest ones. And they have tiny, tiny little acorns. So just the contrast in life of how grandiose you want to reach, and sometimes it's the little things, right? The tree hides in the seed, right? The bird is in the egg and things like that. That's the analogy. So you want to understand that we're here to unleash your full potential, unleash your true healing potential, because as you'll hear me say over and over again, prevention is the cure, all right? There are a lot of things we can do once you slipped into a disease state or a dis-ease state, but there are going to be times where we're going to say, look, you are in some serious trouble, you need to go see a medical doctor in order to get that help. Again, they're the best in the world as far as keeping you alive and saving your life, but their job is not to code you as far as this person wants enhanced quality of life. They want to feel better. It's just not their job. They're not trained that way. So if you just have to understand who you want to work with, right? We've talked about, and if you want to look back at our previous posts, you want to look at how to get the most out of your doctor relationship, right? Go in there with a goal. Go in there with questions. Make sure you understand it. Don't just get steamrolled into something. Make sure you are empowered, and that's what we will do. You will walk out of here every day more empowered, more knowledgeable than anything else can teach you, because we take all the confusion out of it, and we ultimately get down to what your body needs. That's what kinesiology does. Your body knows exactly what it needs. My job is to tease the information out, put the pieces in a row, and then help you understand them step by step, so then you can process it here and apply it here. So we just want to share our mission with you because we feel so strongly about it. As long as you don't need something cut out of you, you haven't broken it, it's come through the skin, or you don't need plates in your body, we can usually fix it. And we don't take that lightly because we are humble enough to say your body knows what it needs to heal. Our job is to enhance your body's own ability to heal. And so that's our fervent mission here, is to unlock your true healing potential. Share your comments with us, share your experiences with us. Let us know how you have felt empowered and emboldened and come more confident here. Let us know what you have questions on. People comment all the time. They tag us in posts for their friends and they say, this might be worth checking out. We're always here for your questions. Even if you're not a patient, just send us your questions on Facebook. If you need our information via email, info@secoyahealth.com. It's pretty simple. Send us an email. You don't have to be a patient if you have a question. We'll empower you with the information to get you where you need to go. If we can't help you for some odd reason, like you need something cut out of you or need some surgery or some life-saving drug, we'll get you the right people. That's our job, okay? We're healthcare providers, not sick care providers, right? There's a difference, so just think about it for a second. Most people often ask, one last thought, why we don't take health insurance. It's because when you're sick or dying, you could put a code on that. We're not dealing with the sick or dying. We're dealing with people who want to maintain their health and take it to the next level and get the most out of life. Okay, so we can't code for that. We can't code for, hey, I want to feel great. I don't want to feel just okay. So you need to know who you need to see, who you want to coach you, who you want to teach you, right? If you have ever had a medical physician teach you something about how to improve your life, I want to know about it. Comment on it. Something that you can take away and use tangibly to enhance your life where you're not dependent on some type of medication or something else. I want to know because I want to work with those individuals because they're forward thinking and they know what you can heal yourself and they want help. So please let us know if you have had that experience. We love to refer people to those individuals because we know they're forward thinking, they're progressive, okay? It's probably functional medicine based physicians, but we don't know, it doesn't matter. As long as they have the heart in the right place and they know your body and you're the healer and they want to enhance that, great, awesome, we want to work with them. So please share your comments, your experiences. Let us know like your biggest takeaway from working with us and things like that. And we will continue to produce information that is beneficial for you. Your comments and your shares let us know we're doing the right things. And we want to make sure that you continue to send us that information because that's what fuels us each week. We get so excited about sharing these ideas with you because we are here to serve you. And we appreciate the opportunity to serve you. And we want to continue to serve you, your friends and family. I know that one of the posts earlier was about touching 1 million lives. I'd like to touch 7 billion lives, maybe 8, who knows. Not everybody's interested in what we have to offer, that's fine. But the people who do need to know about what we have to offer. So please share that with your friends and family and say, if you haven't figured out what's going on with you, these guys know how to deal with the weirdest of the weird. That's our job. We specialize in weird. So if it's unexplained, nobody has an answer for you, come to us. We will help you find it out because nothing can hide from us when we use your body to tell us what's going on. All right? Hope you guys have a great night. Appreciate it. And we'll look forward to seeing you next Wednesday for the Wednesday Wellness Minutes. See you guys.